Hi, everybody. Sorry for the delay. I just want to just address St. Patrick's Day Parade. Yesterday, we made a decision after consulting with elected officials and some community organizers and really thinking about protection of people. And we canceled the parade out of caution in the concern of potential spread of coronavirus. Right now in Boston, there are 8 presumptive cases and 1 confirmed case of coronavirus. The one person is a student from UMass Boston that's doing really well, from what I understand right now. But again, this is a very fluid situation. As you know, this is a national concern that's happening in America now. We're seeing it pass through the country, and we want to make sure everything we can do to prevent the spread of coronavirus. And that's the phase we're in today. We're working with the Mass Department of Public Health, working with the governor's office, working with they're working with the CDCs on constantly getting information out to people, and that's kind of where we stand right now.
Mayor, what's happening with the marathon?
Right now the marathon is on for April. There are conversations happening, but there's no definite confirmation of what's happening. I think this is a very fluid situation. I was asked a question earlier today that I wrote a letter about the PAC Sony event that's happened at the convention center, and I asked them to go forward with it. At that point, we didn't have 8 cases of potential coronavirus in Boston. We didn't have 41 potential cases in Massachusetts. It was a very different situation a couple weeks ago, and in 5 days it's going to be a very different situation again.
Mayor, can you just comment on how you're assessing
going on? About a dozen events coming up with TD Garden.
Yeah, there's a lot of events that are happening in the city of Boston and in the Commonwealth, and I think that I saw it today on the news. Major League Baseball, NHL, basketball, all the sports leagues got together, and they have to make their decisions as they move forward here. The TD Garden, in my last conversation with them, have put they're cleaning the building down, and they've regulated just for the players in the locker room. No outside visitors, no press in the locker room to worry about the spread of the virus, any potential virus. I think this is going to be a very fluid situation. I think as we go here day by day, it's going to change.
What about having city workers work from home? Where are you at?
Yeah, we've been working in the last couple of days now about policies. So we're working on making sure that in contingency plans, in the case of a scenario where we have to have city workers work from home, we're assessing that right now. We're assessing who is potentially essential personnel. When we have a snowstorm, essential personnel, we know who they are. When you have something like the coronavirus, potentially where you have a situation that we see in northern Italy and places like that, it's a lot different situation. So we are assessing now each and every single employee in the city of Boston, and we're preparing for the event that people need to work from home, they'd be able to. We're also asking employees, we've banned all travel from the city of Boston to level 2 and level 3 countries with coronavirus. We're going to everyone has to get approved for any travel of city employees for city business. Will have to be approved through the mayor's office. Also, any employees that travel on their own to level 2 or level 3 countries, we're asking them to self-quarantine for 14 days. We are not penalizing them with sick time. We're going to be working with them to make sure that they're safe, they're safe, and that the employees they work with are safe as well.
And longer term, when it comes to the marathon, I don't know another way to ask this, but how bad does it have to get for you to cancel it?
It's hard to say. I mean, I think that we're looking at some of the other countries that have canceled marathons, and some have canceled, I think, certain runners in the marathon. I think that this, as I said, this is a fluid situation. We're actually working on a policy right now as we speak about how many people should be gathered in the meeting space for the city of Boston. So we're working through all those numbers, and as we get that information, we're going to get it out to you right away.
The marathon's a little over 5 weeks away. When do you have to decide?
The marathon. It's 41 days away.
Yeah, I think the decision, if there's a decision on the marathon, obviously we have to work with other 8 cities and towns, and we'd have to have conversations around that. I think you need some good lead time. The economic impact of the marathon in Boston, I looked at that number yesterday, is about $211 million. So when you think about the economic impact in the city, but at the bottom line, my job as mayor and our jobs as leaders is to make sure that people are safe.
Is it your
so
decision?
we're always going to err on the side of caution.
Is it your decision? Because, I mean, if you decide that the marathon shouldn't be held, is that it?
I think it'll be a collective conversation. It won't be any type of, I wake up tomorrow and say the marathon's over. It'll be a collective conversation. I think there's a lot of moving pieces to that.
Is there anything going on with the marathon?
You set a deadline yet?
No, not yet. No,
What
not
about
yet.
Maybe
opening
these
the
big
schools?
events, are the schools going to remain open?
I talked to the superintendent this morning. We're cleaning our schools all day long. There's not two cleanings going on in our schools. We're constantly cleaning our schools all day long. And we're also making sure that we have all the cleaning products. The kids are washing their hands on a regular basis. We're doing all of that. Obviously, a lot of the colleges are starting now to make some real big decisions here and not coming back. So we are monitoring that. The risk of spread of coronavirus through children is really low at this time, but we're monitoring that really closely. We want to make sure that our kids are safe. Just so there's been rumors out there, our schools are packed with hand sanitizer, with soap, with cleaning supplies. There's no shortage there, so we're going to continue to monitor that situation as we move forward.
Mayor, it seems like these efforts are based around trying to contain this, but
Right
can
now.
you contain it right now?
Yeah.
Federal officials saying we're past that point.
Yeah, I think in some places we're past it. I had a conversation with Mayor de Blasio last night from New York City. I think as of last night, I don't know what the number today, they're at 149 cases. I think that containment is obviously the best option, but I think at some point we don't have any community spread right now that we're aware of in the city of Boston.
Well, isn't that the problem?
And let me just finish and I'll come right back to you. And I think we're going to try and obviously, but we're preparing for the inevitable. And that's what we want. And we don't want to frighten people. I think at the end of the day, just side note, wash your hands. If you're sick, sneeze into your arm. I know people are tired of hearing this, but it's all reality. If you don't feel well, don't go to work. Call your primary care doctor. Take all the proper precautions that need be. I'm asking employers that employees that might not have sick time come up with a policy to help us move forward. Also looking at potential unemployment. A lot of these workers are low-income workers. A lot of our low-income neighborhoods and communities are going to be the most impacted by this. So we want to make sure that we protect those folks as well. So we want to, as we move forward, some of that is precaution. David?
Sorry, shouldn't we be basing this not on the number of cases given the limited amount of testing, but on the knowledge that this is a pandemic that has spread from 30 countries to more than 100 countries in the course of a week, that we now know that it's in more than 2/3 of all states, and that we've only done a fraction of the amount of testing? Why shouldn't we be taking more aggressive action right now?
Well, I think I can speak for the city of Boston. We're taking very aggressive action. We canceled the parade yesterday, and we've contacted our employees. We're going through systems of working at home. We're also talking about keeping the city open. We're preparing in the inevitable if we have to close schools. How do we get those breakfasts and lunches to our kids? How do we make sure that our seniors get the food they deserve? Are we working with the food pantry? So we're laying all that work down now. So we're preparing for, unfortunately, what might be the inevitable in the city of Boston. I can't speak to anyone else.
Mayor, when you say that the one case that was actually positive is doing well, can you tell us what that means? Is he back integrated into?
Not yet. He's still, from what I understand, he's still self-quarantined. Now, I'll get more information on that for you later.
Can you talk about any conversations you're having with Major League Baseball regarding opening day, which actually happens before?
Yeah, I mean, I talked to Sam Kennedy last week from the Red Sox, and I think that the situation again last week compared to this week is very fluid and very different. And I think that the decisions that the sports leagues will have to make, whether or not allowing people in their arena, those are going to be based on some facts that they're looking at today. However, to David's point, that might all change within a matter of a short period of time, depending on the spread of this and what we're looking at. Major League Baseball, NBA, NHL, they're about to enter into playoff season. Seattle, New York, both major cities that have been kind of deemed the epicenter, if you will, in the United States of the virus, all have sports teams. They have soccer, they have all these sports. So, I mean, this is going to be a conversation going to be at a league top level.
And for people who don't think this is as bad as it sounds, because there's a couple dozen cases here in Massachusetts, what would be your message to them if in fact...
take this serious. This is, if you just look at the Prime Minister of Italy has basically asked everyone in Italy to stay home for the next 14 days. That's over 60 million people, I think. I think I get the numbers right. Think about the seriousness of that. And they shut museums down. They've shut basically businesses come to a stop. In Italy, they're taking this dead serious. In China, Wuhan, China, maybe a little different situation, but they're doing some quarantine there as well. Obviously, we're balancing in the United States. We have the civil liberties of people's rights, and we're not going to take those rights away. I'm working with Carol Rose and the ACLU to make sure that we protect people, but also observe their rights and protect their rights. They have a right in this country. So I think that the best we can do right now is take the steps to be cautious and be careful and to prevent the spread of coronavirus. We could be having a conversation in 5 days that's very different than this one. But the fact that I'm spending about 60-70% of my time as mayor of Boston right now focused on the coronavirus tells you right there how serious it is. I've been canceling meetings all week, not because I don't want to meet people, but because I've been focusing on the coronavirus. We're taking this very serious. Every aspect of this virus we're taking very serious.
Do you foresee a situation where the marathon is allowed to go forward? Is it inevitable that it will be canceled?
It's hard to answer that at this particular moment. Now that might change in 3 days and 2 days, but as of right now, I don't have that information for you.
Do you have a plan about the availability of tests? Like one of the things we heard last week from some doctors, prominent doctors in Boston at a state house hearing, there's not a lot of tests. We hear that there's more coming out, but I don't know how much that's the role of the cities or Department of Public Health or
the state Department of Mass Department of Public Health does the test, and it's my understanding that private companies, there's a couple of private companies that are going to be entering into doing tests now, so we'll be able to maximize the amount of tests. And I think there was an issue with the CDC's getting the test down to cities, so I think that in states, I should say. So I definitely think that where we can increase the amount of tests we can take. I think that the numbers that we're looking at are probably less than the actual numbers. I think the actual numbers are a lot higher of people that potentially could have coronavirus in the United States of America, and I think the numbers are lower because the tests aren't available enough across the board.
Mayor, would you postpone it or cancel the marathon? I know no decision has been made, but would you more
I mean, I think those conversations, we're having those conversations, and I think that, realistically, I mean, in a perfect world, I think if for some reason the marathon can't run in April, I think I would much prefer to see a postponement than a cancellation. I think that, people, I mean, the economic impact, I talked about the economic impact for a business, $211 million. $36 million in charities. And people are out there raising money and doing things. All of that stuff's happening today. So again, I think that this conversation is pretty fluid, and it's going to take leaders talking together along with the BAA and other organizations, because it's not simply just canceling it today and having it tomorrow. There's a whole host of other, public safety, federal government, a whole host of hospitals, making sure the capacity, all of that stuff.
Are you talking to the BAA about only bringing elite runners? Is that an option that's on the table?
That's never been talked about.
Okay.
Do you have a plan ready to shut the city down if you needed to? Is there?
We're working on it right now.
And any plans in place for the homeless population?
Yeah, thank you for bringing that up. We're working right now. Our Public Health Commission is working on homelessness. We're looking at the potential if we have to kind of take a large group of people, which is a large group of people, and spread people in different parts of the city in smaller groups, so we're not having 300-400 people in a room at the same time, because our facilities are basically all, they're bunks. And everyone's kind of in the same space. So we're researching that now as far as spreading people across the city of Boston, creating mini shelters, if you will, in different areas. We haven't moved to that point yet, but we're developing a plan for that.
Do you have a press conference outside because it's such a nice day, or are you concerned about a confined space?
No. This wasn't something I actually wanted, but we got so many inquiries. So it's not technically a press conference, but it's an impromptu kind of thing because I had no public events on my schedule today. So to get access for you guys.
Quick question on the parade. You talk about the economic impact. Business owners along that route today have been complaining all morning long about the loss of business because of the cancellation. Can you just respond to their personal frustration?
Listen, I mean, anyone's complaining about this. I don't want to be insulting. You can't complain about this. You can't complain about this. I mean, it's about public safety. It's about protecting their patrons. A lot of those businesses along the parade route have done incredibly well over the last 5 years. They're busting at the seams on the weekends. I see it. And I think the fact that if somebody's complaining about it, you're being irresponsible as an owner. I think you need to understand that this is not something I did lightly. And you're still going to have people there Sunday. People are still going to use the facilities. I don't know, in particular, I know most of the restaurant owners, so I don't think it's the people I know. But yeah, I think to Shaman's point, take this serious. This is an issue that, when you think about all the top reporters are here today. You're not here because you want to be here. You're here because this is an important issue. So I would ask all the people to be patient. The last thing I want to see is the economy in Boston collapse. I don't want to see the economy in the country collapse. I want our restaurants to be full. I want people to come to our city, and we want to make sure that we're safe. If we don't take the precautions today, then we don't know what's going to happen tomorrow. It could be far worse tomorrow, and the concerns that they have could be far worse.
Mayor, you mentioned that you have concerns the numbers could be higher because of the lack of tests. Can you say how much higher? 2 times, 3 times?
I'm not a scientist or a doctor, and I think that's a question you'd probably have to ask somebody like that. I don't want to give a false number. It could be either too high or too low.
Higher in Massachusetts?
I think it's higher in the United States of America, which we're part of, and I think it's a higher number potentially. Potentially. Now, a lot of the cases, I don't know if Marty Martinez is here, a lot of the cases that we have in Massachusetts, the majority, except for maybe less than a handful, are off of Biogen. What happened at the conference. So again, that's to some degree contained, if you will. So we're able to public health officials are able to track down what contacts they've had. We haven't had necessarily a community spread, and that's what we're concerned about. And I think that's what we have to watch out for that, and that hasn't happened yet. That we don't know. Yeah, exactly. So I think that again, to right now, but I watched those numbers in New York City, and those numbers jumped in a matter of 3 days. They went from, I think, 50 or 40 or something like that to 150 today, and we know there's more today. So there's concern there. And I think that people that are trying to equate this to the flu and say more people die of the flu, maybe that's true. But 6 months ago, none of us knew what a coronavirus was, or I didn't. And we weren't talking about coronavirus. And the impact that has is how do we make sure we try and get ahead of this? And I think that's the fear, or that's the concern that people have. And I want Bostonians and people listening not to be fearful, but to be cautious and to wash your hands and to make sure you do all the things. If you have any questions, you go on the City of Boston website. We have all the information on the cityofboston.gov, or you can go on the state website. There's all the information there. If you're a Boston resident, you can call 311 and call our main hotline. We will hook you up with somebody. You can call our city council. We're briefing our city council as the days go on. You can call whoever it is you need to call to get the accurate information. Don't just go by hearsay. Make sure you do the follow-up. And I know that a lot of you, the press, I would ask people too, when you watch the news, you have the stories obviously, but you're also passing information out to people. I would ask people to pay attention to that information that's being passed out. This is something that is important.
What do you say to people that say this is being blown out of proportion? They're blaming the media. They're blaming city officials.
I hope it is. I hope it's being blown out of proportion. I hope that I can stand here in 3 weeks and say it was completely blown out of proportion and we did all this preparation for nothing. But I'll be grateful for that. I'll be happy if I have to do that. Unfortunately, I don't think that's going to be the case. All right, thanks everybody. Thank you.